this little class, I'm going to demonstrate a needle decompression, which is intended for a tension pneumothorax. So you have the model here, high-def mannequin, and we're going to do this with an anterior approach. For this model, we have a black balloon, and you want to give it 2 pumps after closing the valve clockwise. 1, 2. This will add air into that space. Before you do the procedure, you want to make sure you have the right equipment, and we are going to be using a Cook Pneumothorax decompression kit. This includes the actual needle as well as the tube. It also has an antiseptic, Heimlich valve, and tube. If necessary, and usually this is an emergent procedure, we have an anesthetic, so we have lidocaine in the capsule, which you can crack open, and then a needle to use for injection. But for the purposes of this emergent procedure, we are not going to do that. So for the procedure, you want to identify your anatomy. So you have your clavicle right here, and then right under the clavicle is your first rib. If you pull down a little bit to right here, inferior, that is your second rib, and in between that is third rib. So you're going to be going between the second and third rib at the second intercostal space. You're going to want to follow it down to the mid-clavicular line, which will be right here. Remember, you're going to want to place that needle directly above the rib because you have your neurovascular bundles that are directly below the ribs. So, for the purpose of this procedure, we're going to clean with an antiseptic scrub. You have the option of using sterile gloves, but it's not always necessary. At this point, you have placed the antiseptic, and now you're going to want to place the needle with the tube. So using your finger to track directly over the rib. You might hear a little whoosh, and then you can remove the actual needle and place the rest of the tube in. Okay, so you want that completely in, and now you can place the actual chest tube like so. I'll move the valve, and then you can place the actual Heimlich valve on top of that. Well, you will notice that you're in the right place. If you do compress the bulb and you hear or feel air coming out of the Heimlich valve. After the procedure is done, you have the option of taping it in place, or you can suture it in. Oftentimes it's done with a purse string suture. Ultimately, after a needle decompression, you will want the placement of a chest tube.